Welcome to the Nonprofit Report, your update on nonprofit organizations, issues, and leaders, viewable on M. Oppenheim TV and YouTube. Today, we are chatting with the leadership team of the Idaho Youth Ranch, and I'm so delighted to welcome Scott Curtis, Chief Executive Officer, Amy Evans, Vice President of Programs, and Deborah Imbrogno, Executive Director of the Residential Center for Healing and Resilience. I want to welcome you all. This is just such a fabulous discussion, and you have this long history, and you have just opened your residential center, which is just a huge deal in the state of Idaho. So, Scott, let's go to you, and just if you could just give us an orientation. You were founded in the 1950s by this wonderful, wonderful couple, and you're operating today. You've just had this sort of refreshed facility. Give us a sense of the impetus for the founding and where you are today.
Yeah, thanks, Mark. I'll tell you a little bit about our remarkable founding, because it's a great foundation to stand upon. James and Ruby Carey Crow, they were a couple in rural Idaho that had mostly finished raising their own children. He had been a chaplain in the military. She was a school teacher. And so they went on quite a letter writing campaign and influence campaign to get the federal government to actually sell them at $1 an acre, 2,000 acres of land in Idaho, in rural Idaho. It was sagebrush country. And that's where they built Idaho Youth Ranch. And they started bringing in the 50s, what they referred to as wayward boys. Boys who were getting in trouble for various things, and that they thought a ranch lifestyle would be helpful in terms of helping turn their lives around. And so that's the foundation upon which we're built. Just really good-hearted people bringing caring adults into the lives of kids who are hurting. And I would say that if you look back at the thread of Idaho Youth Ranch now for more than 70 years, it's that, getting good-hearted people, caring people, adults in the lives of kids who are hurting. It has changed a lot over the years, and the professionalism of that programming and the staffing has changed. That it used to be one organization located outside of a small town in southwestern Idaho called Rupert, and it was actually 12 miles on a dirt road outside of Rupert, where this original ranch was. And it evolved from there to other services across the state, and some of which we don't have today. But the organization has evolved and been reactive to the needs of youth and families, again, for the last 70 plus years, with various services from group homes to outpatient programs to other inpatient programs. And now I'll tell you the general footprint today, and then I'll really lean on my colleagues, Deb and Amy, to talk about here's the programs Youth Ranch is operating today.
Well, let's just take a pause, because one of the things I find to be so fascinating is the core impetus, which is about how do you actually heal society by helping these young boys initially figure out themselves, right, and make a positive contribution. Then over time, people start to really understand the threads that connect to that purpose. But the purpose remains, right? I mean, your purpose is still to heal society. It's no different. Maybe your programs have changed because people become more aware of effective approaches, but the actual impetus, the heart, remains, doesn't it?
Yeah, and it's healing society through one person at a time, one youth at a time.
Amy, when you're looking at your programs and you're creating the modern version of that mission, you're investing your programs with that modern version of that mission. How do you shape programs in today's modern world, informed by today's knowledge and approaches, to translate that into changes that these young people can embrace?
Certainly, understanding the challenges that the youth face now are very different from the challenges that they faced. And I apologize, I'm got a little cough. It's very different from the challenges they faced in 1950. I mean, right now our youth are struggling with all the social influences that they find, social media, online influences, and the bullying that can happen there, the exposure to traffickers that is happening.
Human traffickers.
Human traffickers. The challenge that we're still facing with COVID and the social isolation that happened with COVID, and excuse me, and again, more exposure to the online challenges that the kids face with COVID and being socially isolated, which then they turn to trying to connect. And how do you do that when we're in isolation? So to answer your original question, is really meeting the youth where they're at and addressing their current challenges, which is always evolving, right? And we just lived through that with our struggles with, like I said, the social isolation with COVID. And we're seeing that in our youth, the depression, the anxiety, self-esteem issues as they return back to normal life over the last several years.
So, Scott, as you're developing the organization, you end up deciding that you need different facilities, and we're going to go to Deb in a bit. And as you're looking at the challenges that youth face, does that mean that you are hiring different people with different types of expertise over the years? And how does that work? How do you determine what kind of a team you need as a chief executive officer?
Wow, that's a great question. I would say, Mark, it's often not determining who we need to hire, but how we need to adapt, even with our current staff. And then, yes, when we're hiring folks, we look for folks that are bringing things to the table that we may not have. So, for example, with our residential center, we needed to bring in some folks that have deeper, longer residential experience. We needed a level of psychiatric background that we didn't have in the organization at that point. But I'd say the transformation has been more, rather than hiring people, it's been across the board. Just becoming more trauma informed, and the impacts of trauma on the brain as an organization over the last 15 years has been huge. I'm assuming many of your listeners will be familiar with ACEs, or adverse childhood experiences, right? What they probably wouldn't suspect is that Idaho's in the top 5 of the nation for youth that have 3 or more ACEs. Most people don't think of Idaho that way. We're a relatively rural state, proud state, conservative state. We've got some major gaps. Right? The last ACEs data I saw showed that we were second highest in the nation for youth that are living in homes that have mental illness. We have an extremely high rate of youth that have an incarcerated relative in their family. So we have a lot of youth living in poverty. Amy was mentioning COVID. At one point during COVID, we had 25% of youth in Idaho that were suffering from food insecurity. Wow. Which means not knowing where their next meal's coming from. We now understand the brain research is catching up, right? And I can't even believe the brain research since I left graduate school 23 years ago. We understand the impacts of that trauma and what's happening on kids. And so to translate that understanding into an existing agency has been one of our challenges. And quite frankly, it's been a great opportunity and something that we're really proud of. Having trauma-informed care in all of our programming has been essential. And Deb and Amy can both talk about that. Deb, in particular, about the residential center, starting that from the ground up. But I do want to say, it's not just that, Mark. We have 24 thrift stores across this state. We have 350 staff that are never involved in the clinical programming. They're also getting trauma-informed training because it's about us educating society in general as well. And that's been a great thing for our organization.
That's a fabulous point. We're going to come back to that. But I'd like to go over to Deb because to heal trauma, you have to start off with safety. Mm-hmm. You have to start off with security. You have to start off with a little bit of predictability. Mm-hmm. You cannot address trauma in a traumatic environment. So, Deb, talk a little bit about why it was so important to invest, because it's a huge investment of resources in a residential center, and that residential center will absorb resources going into the future. So it has to be justified from a business perspective in terms of the benefit to the youth that it's providing. So describe how you came to create the residential center and its importance in the context of your programs today.
Thank you. So I think at the root of everything that we do is looking through the lens of trauma-informed care, right? That's how we create a safe environment and keep it safe. So that is super important. And like Scott said before, when I started in this work, trauma wasn't even part of the discussion,
Right.
right? So like really dialing that in and getting that into everything that we do, whether it's in the classroom, it's in the dining room, it's in how we interact with each other, really having a very strong and informed culture around that.
Well, and a sensitivity to know that anything can be a trigger, right?
For sure.
Be
Yeah.
standing in line and waiting for your turn to be to receive some food. If you've lived with food insecurity, that is a triggering event for a young person.
Yeah, for sure. I mean, all of our youth that have come here have experienced some form of trauma, right? So for us to understand what has happened, how they've experienced it, right? And make plans to not reenact that trauma is very important too. And we have expert clinical staff that really guide that part of the treatment. And part of our program that we are really, really proud of is the family inclusion, right? Our youth and families are active participants. We are all at the table doing this. They're not recipients, right? Participants. And I think that's a shift as well in terms of care.
That's so very important, right? There's always been this idea, and it comes from a good place, of we don't have the problems, you have the problems, we're going to solve your problems, right? And that's a disempowering perspective, right? Actually, the answers generally are developed by the people who are, quote, receiving treatment, and they are giving as good as they're getting, aren't they?
Absolutely. And the parents are the experts on what's happening, right? That's really important that we honor that and we approach every situation and every family interaction without judgment and really just being open to being supportive and how can we help, right? And creating spaces for that, safe spaces for that. We do individual therapy with the youth at least twice a week. Sometimes it's every day. We're doing weekly family therapy. We're having monthly interactions where we're just sitting down and eating so that there's not even the treatment focus piece to the interaction so that the staff and the families get to know each other. You know, just creating safe environments is so important because without safety, you can't do the treatment, right?
I want to talk about this idea of the family and the extended family as being sort of the partnering with people who are outside of the family, which is so interesting because in certain respects, we say to ourselves, so many of our social problems really, we shouldn't be having, quote, outsiders. It should all be about the family. The family should come together and solve their problems and so on and so forth. But sometimes families require help. So as Amy, Scott, Deb, as you're looking at how you interact with families, how do you create that kind of trusting environment where there is this idea of adding expertise, adding a perspective, adding perhaps a neutrality that the family itself doesn't have in their dynamic? How do you actually create that setting, Amy, so that as you're developing your programs, that can unfold in a natural way that is individualized for every client and every family that you have?
Yeah, I'll start this, and I know both Scott and Deb will have a lot to offer as well. One of our core values is relationships, and why I mention this is a big part of the work we do and our teams do is collaboration with the families and those involved in the youth's life. And so our teams will meet with the family members and identify who else should be at the table, whether that's the youth's favorite teacher, whether it's their pastor, whether it's their next door neighbor who's been that reliable adult in their life, whether it's a coach. And we help facilitate that team to wrap our arms around the youth, provide the scaffolding to the youth and the family for the next step of their treatment and their journey along the way, to ensure that we're all collaborating together to help. Again, I overuse the word scaffolding, but to provide that scaffolding for the family, for the youth along their journey. But it's a partnership, it's a collaboration, and it's very intentional and specific to the youth that we're working with at that time.
Deb said one of the pieces before, she said, the parents are the experts. Even having that attitude and philosophy, that's not something you can fake when a parent walks in the room, right? And you said, so I would say that's foundational to parents entering into trust and feeling respected. And by the way, that's a hard thing culturally to replace if there's an attitude that parents are the problem. So from the very beginning, we have to all be actively working to say, these families are coming to us and they probably aren't getting to us because they've never made a mistake as a family, but these kids have long histories and they have successes too. And also our job is to help them transfer back, right? I'm talking about residential now. In the residential care, our job is to help them transfer back successfully. The only way we can do that is by tapping into the strengths of the families. There's a practicality to this too. We're privileged to walk for this much of the journey. This family is doing the journey for this long. And the research is pretty clear that it needs to be a pretty significant issue to remove a child from the home and have those outcomes be better long term. And they're even going back anyway. They're going to go back once they're adults. So how do we help them overcome it?
What does your funding look like? How does that knit together in terms of sustaining the organization?
Well, that depends. That's changed actually in recent years. Our funding is for the residential center has increased the amount of funding that we're getting from Medicaid, just because the number of our youth that are on Medicaid and that Medicaid will reimburse for a psychiatric residential treatment facility or PRTF. Idaho did not have a single accredited facility. So for the first time in anyone's memory now, we're able to keep Idaho kids at home who are on Medicaid and give them this kind of treatment. So our Medicaid, the Medicaid side of our funding has gone up. We're really fortunate as a nonprofit to have a number of legs to this stool. One of them is our thrift stores. So we have very successful thrift operations in 24 stores all over the state. We also have individual donors. We have quite a history, being over 70 years old, of donors throughout the state that believe in our mission and support us. That also includes some corporate, and we have grants. Although our grants are smaller than probably most organizations, we don't have a lot of government grant dependence. Although we do have some, particularly for our Hayes shelter home, which is a short-term shelter.
One of the things that I find so admirable is the diversified revenue that you've been able to develop. You're not totally dependent on government grants, which a lot of organizations are. And you have the Medicaid reimbursement side, which, as you were building the residential center, you were very aware of. And then the thrift stores, those are amazing assets because it also gets people involved. In terms of how you actually operate, there was reference previously to the idea of educating everybody who gets involved with you with the modern idea of trauma-informed care, of looking at the threads that cause challenges and then addressing those threads individually. In a sense, you're healing society. How do you ensure that those messages get out to your donors, to your supporters, to people who come into your thrift stores, more broadly than just the people who are achieving some sort of a treatment event with you, Deb, or with you, Amy? How do you do that?
It's a great question. One of the things I'll see, if you look at our impact reports and our brochures, they all refer back to statistics about what Idaho youth are facing. We put it out there. When we did our capital campaign to build the residential center, that ended up being a $36 million campaign to open that debt free, mostly meeting with individual donors all over the state. When we created the materials and the PowerPoint presentation we walked through with them, we started with what's going on with youth. We educated every potential donor about ACEs first. We explained ACEs. Then we shared the Idaho data around ACEs and what we intend to do to meet it. So we really took it as an opportunity to educate people, many of whom decided to support us, but others were educated and be able to use that wherever they are.
So your pitch, in other words, to your various supporters was this is about strengthening Idaho's civil society and the environment for youth. It was basically a community pitch. Let's pitch in to make the state better.
Yes, and the tagline of that capital campaign was bring Idaho's kids home. We need to take care of our issues in Idaho.
And Idaho is not everybody's going to be physically near. How do you deal with that issue? Is it mostly, do you mostly draw the people you serve from a particular geography in Idaho, or is it statewide?
I think that we are up to 20 counties at this point at the residential center that we've helped families from. So I would say statewide.
The first graduate of the residential center was a youth from just south of the Canadian border. So almost as far away as possible from the residential center in Idaho was the first graduate. We're really proud that it serves the entire state.
So Boundary or Bonner County, somewhere up in there?
Yeah, exactly.
That's interesting. So how do you deal with the logistics of that? Because, logistics is a big cost. And particularly if you're a low income family, right, it's a big deal. How do you deal with that?
Well, one way I just will say part of the program Deb described is families have to be involved. So they're involved in weekly therapy. So some of that's through technology. Like we can do virtual therapy in the residential lodges where the youth are in the evenings and during their downtime. There is the ability for them to talk directly with their families virtually, and because we want to encourage that. We also have families that travel from across the state. Deb can talk about what she does and also what we have in the plans right now to facilitate that.
That's really interesting. It's a really interesting point because one of the points that were raised is that our devices are creating a kind of a social isolation. And there's also technology can create all sorts of negative mental health impacts where people are being mocked for their own self-conscious things that they process as flaws, and then they go into a spiral of depression and so on. But you're also saying, Scott, that you have technology because we have this instant communication with family. You can actually create connectedness with somebody in one of your residential centers. Deb, how do you deal with balancing, creating the right balance that is self-administered by young people and by families so that technology, we're educating people on how to use technology in healthy ways and employ that in ways that advantage us as opposed to the negative ways that we have also experienced?
So I would begin with, for our youth at the residential center, they're learning how to use technology responsibly through education. In our classrooms, all of our youth have Chromebooks and they're taught, what's appropriate and what's safe. Then we also will do telehealth when needed if a parent is not able to get here. So we do a lot of education around that.
And Amy, do you have any particular approaches that you try to invest in all of your programs, or is this more idiosyncratic?
No, I will say that telehealth has provided us a great tool to be able to reach, in particular, the rural communities who may not have providers in their area. And so it does allow us to reach the youth who really just don't have services in their own community. So to answer your very first question, it has really benefited the care that we can give and helped us expand our services, again, in particular to the rural communities.
We're also wondering how we're helping youth navigate all of the social things. Is that one of the things you're wondering?
Yes.
That's a huge challenge. I think Amy and Deb and I would all say we're trying to teach them, and a lot of that's through the one-on-one therapy or the group stuff at the residential center. But I'll tell you, we don't have that mastered for our communities. I mean, this is a huge issue.
If you had it mastered, I'd love to hear the answer, and then we could tell everybody what it is.
Some of that's education of parents, though, Mark. We do have access to some parents, and some of that is the education of parents. Like, what are appropriate boundaries to put on that? Because that's where a lot of the attention needs to go.
In closing, I'd like to talk about the things that the state of Idaho has in common with everyone else in the world in the United States in terms of this issue of serving youth, and also the aspects that are unique. Let's just go around the room. We'll start with Deb, Amy, and then Scott. If you could sort of close us out in terms of Deb, where you see there are commonalities and differences. What do you see in terms of how your organization addresses the needs of Idaho youth?
So in terms of commonalities, we're using best practices. We're really creating safe spaces. We're meeting folks where they're at, because we know kids are kids, right? And so really just engaging, I think, is the most important part, building those relationships. And those are commonalities, and it doesn't matter where you are in the United States. Those are just really important things.
And what do you find to be unique about Idaho youth that are living in Idaho?
I want to talk about the spirit of the community. There's not a NIMBY attitude. It's really like, how do we help our kids? How do we help each other? And how they come together to do that is incredible. I can't speak enough to that. That was something that really struck me as being very powerful about Idaho, was how everybody came together.
Is there a view that these are our kids?
Absolutely.
Our kids?
Absolutely.
Amy, how do you leverage that? How do you get people involved in the our kids philosophy?
It's sharing stories, sharing the challenges that our youth are facing, communication, relationships, education. We're so fortunate to have such a caring state. And Deb touched on it, and I just want to emphasize what she says. Idahoans care deeply about their youth and each other. It doesn't even have to be youth, but in particular for this conversation, their youth. And when there is a need, they step up and step in. And we have been so fortunate to be supported by the entire state to help us do the work that we're doing. So I really do think that the commonality is everybody cares about youth, wherever you are, right? But Idahoans step up. And they step up quickly and with passion.
I love that. And Scott, that must make the pitch for funding, for support, for partnerships. It must give you a leg up, as opposed to perhaps other environments that we sometimes experience around the country of division, where it's not necessary to be divided. When you have those conversations, what strikes you about the unique aspects of being in Idaho?
Two things. One, I've seen a change that you no longer talk about youth struggling with mental health or suicidality, and people respond as if, oh yeah, I've heard about that. Now everybody knows somebody. I mean, it's pretty ubiquitous, the understanding of mental health, and it's a family member, it's a friend or whatever. So I think that we tap into. And the other thing is, Idahoans are aware that for the most part, it's a conservative state that has not asked government to solve issues, and there's relatively little public funding. And so what has to go with that is people, individuals, corporations, et cetera, stepping up and helping us solve the problems, because the solutions aren't free. Right? We do have to have some expenditures. So we tap into both those pieces of awareness of folks in Idaho.
You know what you're saying, don't you, Scott? You're saying we are the power. We are the power. We can decide, and we can act. Yeah. And I just like to thank you all for your work. I'd like to thank your boards, your staffs, your communities, your clients of the Idaho Youth Ranch. Thank you so much, Scott Curtis, Chief Executive Officer, Amy Evans, Vice President of Programs, Deborah Imbrogno, Executive Director for the Residential Center for Healing and Resilience. Thank you so much for sharing your insights with us today.
Our pleasure. Thank you.